Hey, Rishi, why don't we go ahead and get started? It looks like we have quorum, or at least enough people. Yeah.
Yeah, absolutely. So let's do this. So for everyone that's joined us, thank you so much for joining us today. My name is Rishi Duda. I am actually one of the people that manages the Canadian market for YouGov. I'm not sure if many of you know, but YouGov has been around for the last 20 years, and we've been making an emphasis on the Canadian marketplace. And we're just looking forward to sharing some of our insights and our findings in regards to COVID-19. And I'm joined today by two of my colleagues, Evan Williams and Alexander Marcellet. Alex, would you like to introduce yourself?
Yeah, for sure. Welcome, everyone. Thank you so much for taking the time. We're definitely excited to show you what we've got for you today, looking at some of the research that we've been doing on the COVID-19 epidemic with a specific focus on the Canadian experience. As Rishi said, I'm one of the sort of two people that are focused on the Canadian market. I'm based in Toronto myself. Maybe Evan, do you want to go to the next slide and kind of run through some of these intro slides before I kick it over to you? So in terms of what we're going to cover today, we're going to just very broadly give you a sense of what we're doing in the context of this pandemic as a market research company. And give you some insight into some of the first waves of the monitoring that we're doing. So as Evan will discuss, we're essentially doing weekly surveys, not just in Canada, but globally in many other markets as well. But within the Canadian context, we're running surveys every week on different metrics that Evan will run you through. And so we're going to show you some of that insight. And the third step, or the third component of the webinar, is going to be to give you a sense of what we're going to be working on next, and give you a sense of other resources that we might be able to make available to you. Evan, do you want to go to the next slide? Okay, so just before I kick it over to Evan, who's actually going to run you through the research that we have up to this point in time, because many of you on the call are maybe sort of new to YouGov, I want to just very quickly give you a bit of a sense for what YouGov is. So essentially, YouGov is a market research company, as I mentioned a moment ago. We specialize in survey-based research, and we do this for many different types of clients. We do a lot of academic work, nonprofit. We also have a lot of commercial clients. Within the academic sphere, we do a lot of, in normal times, we do a lot of political science work and sociology, and to some extent we do public health work as well. And in the current context, obviously, we're pivoting into that domain quite a bit more. We do various kinds of projects, sort of ongoing data feeds, and also sort of bespoke consulting projects for various clients. And with that, I think, Evan, do you want to sort of take it from here and give us everyone a sense of what we're working on with respect to COVID-19?
Yeah, sure. Hi, everybody. My name is Evan Williams. I'm a director at YouGov, doing a variety of things. And lately, what I've been spending most of my time on is obviously, the topic of today, COVID-19. YouGov right now, as the world has really shifted to this as the focus for everyone, has prioritized right now kind of putting our data to use for the public good. So a couple things that our organization is involved in. We make our data available. You can see it on our website, and then through some important partnerships that we have, including the Imperial College of London, who is at the forefront of trends and information and is feeding that information into government bodies and public health organizations. So we're spending a lot of our time right now providing that data that we have to the WHO and to government bodies around the world. And as we've gone down this path, we've talked about sharing that to more organizations and to more businesses and to more people that would value having that. And so you'll see a lot of data points that are free on our website and also sometimes in our LinkedIn posts and whatnot. As we've gone through this and we keep working on this, we obviously have big clients, small clients all over the world, and they have been coming to us as well and saying, you know, we need help sorting out what consumers are going through mentally, behaviorally, how they're changing. And so as these requests have come up from our clients and people that want to work with us, we have created now bespoke and syndicated data solutions for clients and for organizations that would need this. The kinds of stuff that we've been creating, obviously they'll go into much greater depth and detail. If it's a specific sector or industry, we'll have data on that, and we'll have understanding of behaviorally how people are changing. And these are things that if you're on the call and you want to tap into at the end, you know, we can talk about that, or, you know, we'll just give you an email and you can follow up with Rishi and Alex, and they can help you out. But, you know, a lot of what we're doing right now, it's really intended to help us both serve our clients and people that want to work with us. And then in some part, this is also helping us to fund the work that we're doing for free for public health organizations. This is just a screen grab of the kind of data, if you haven't been on our website, that you can go to. This particular one we have is on the screen is looking at people who are avoiding crowded public places. Obviously, social distancing is one of the most important behaviors to exhibit and then claim you are doing. Hopefully it's not just claiming it, hopefully we are doing it in terms of overcoming the pandemic and seeing, you know, the daily new cases decrease. So we asked this question and a variety of other questions consistently in an organized fashion across the entire globe. You can see all the countries that we include. It spans most of the globe, APAC and US and Europe and the UK and so on and so forth. So we have a pretty good understanding of where compliance is high, where compliance is low. I spend much of my day looking at this information in depth and trying to understand, you know, as we see growth trends, whether you're looking at the WHO or Johns Hopkins or any of these websites and organizations that are tracking confirmed cases, new cases, recovered deaths, trying to understand the trajectory and when this might end in different countries really ultimately requires us to understand the behaviors that are driving those numbers up, right? And so that's what we are trying to understand, is the behaviors that are driving those up and whatnot. Okay, so this is just a little bit of a screen grab. You can spend more time if you want to on our public site sifting through this information, and it's quite interactive. Sorry that it looks like a little bit of a hairball on that chart. Okay, so I won't spend too much time on this. You can see the website here. You can see the markets that we're tracking this. If you are already a client of YouGov, then you might be familiar with YouGov Profiles and Brand Index, which are some of the products that we typically have. And for those of you on the call that are actually subscribers to these, there are new variables and new filters. You can look at your information and cut it by different questions that we've been asking around COVID-19. So that's obviously a free service for you with your subscription on Profiles and Brand Index. And if you do have these subscriptions and you don't know how to use that, or you haven't seen that yet, you can certainly get in touch with us, and we'll help explain it and coach you on it and train you on it so that you have access and confidence in using that. Okay, so I will go and talk a little bit about where we are today and what we've learned today. And this is specific to Canada. We are running these webinars for global markets. We've done it for the US. We did it for the UK today. Next week, I think we're going to be doing more of them. So if you like this, and if you think you want more, and your sphere of responsibility extends beyond the Canadian market, and you want to know more, like, this is something that we can give to you, and it's no problem. So just let us know. This is a very brief summary. There aren't bullet points to the summary, but it's just one point. And the key to winning is just basically a sense of urgency and comprehensive compliance. So last week when I presented this information on the US, and I was looking at data in the US and what Americans are doing and what they're thinking, I see a very, a different picture than what I see in Canada and the UK and around the world in terms of how Americans are thinking about this and how they're behaving. So I'm American nationally. I'm from the U.S. I'm from Minnesota, just from across the border from Manitoba. I live in British Columbia now. So when I look at this data in depth now, I'm putting on the hat of, also a resident and someone that's living in British Columbia and experiencing this, and then looking across the border at what my friends and my family are experiencing in the United States right now. So a sense of urgency and compliance is really what we're monitoring in the data we'll share today. I won't go too much in depth on the methodology. This is very quick. The data that we have here, we run this every week to 1,000 people. It's a standard business model that we have. We have numerous dozens, if not hundreds, of professionals that make sure it's statistically robust. When you see data on the pages, if it's a 1 or a 2 point difference, you don't need to ask if that's statistically different. It is not. And even if it was statistically different, 1 or 2 points really doesn't matter. Look for proportion, look for trend, look for size, and that kind of gives us the better and bigger insights. But nonetheless, it's robust. It's nationally representative. We look at this across regions, age, gender, income, various other demographics, and then we make sure that the data itself is reflective of the population. YouGov has a history in political polling, and obviously to do correct political polling, if that's even possible, you need to make sure that you are buttoned up on making sure your weights and all of your research methodology is sound, and ours is. So I won't go into every single detail on that, except to say that it's good stuff. What I'll share you today, it will be described as wave 1 or wave 2. These are the dates. We do have wave 3. Today's April 3rd. We have wave 3, which was from the most recent week. That was just released very late yesterday, and so I wasn't able to get it in for today's webinar. We were building the material before that became available, but we certainly are doing this every single week, and we have last week's data, and that gives us the trends that we need to see. But this will be just a little bit of a snapshot of perhaps what we've seen over the last 2 weeks before that, and this just changes so rapidly, right? I was looking at some of the data yesterday on Johns Hopkins, and the doubling rate right now in Canada is roughly or has been historically for the last 4 weeks. It's about every 8 days. So for 2 weeks straight, 8 days, it's been doubling. And if we imagine it continuing to double at that rate, the acceleration of it, puts us, globally, this will put us around 4 million people in 2 weeks if it doesn't slow down. So, it changes so quickly, and the data that we have, we need to make sure we're looking at this in the most up-to-date fashion. So take that with a grain of salt. With the date here, just about 7 days old. Let's first look at opinions and perceptions of COVID. How are people thinking right now, and how are they reacting? Well, we started on this, this as a company, we started on this probably a month ago, and it seems like, well, not too long ago, a month, but a month in these days is it feels like forever ago. But we have been looking at awareness, and obviously this one is fairly intuitive. No one is left behind unknowing. It's universal. There's no excuses now that people have, well, I didn't know, or it wasn't big in my country, or it wasn't big where I live, and I don't look at national news that often. It doesn't matter. It's universal awareness. It doesn't matter your age, your household type, gender, who you voted for, how much money you have, or how much education you have. It really doesn't matter. This is a global, everyone knows, everyone is thinking about it type of topic. When we look though at fear, and fear can be a powerful motivator to some extent. Looking at fear that people may have, and the reported fear they have of contracting the virus, this is not universal. This is not 96%. In fact, roughly 40% of people in Canada do not say they are scared even a little, or not at all. And this is kind of concerning. Now, I don't think we should all be panicked, and it's the type of thing, we still have internet, we can still communicate with each other, we still have homes. you know, and whatnot. But this kind of, when we look at this not scared number, it starts, you should start thinking about that, thinking, well, if you're not that scared, what is the level of urgency you personally feel every day to stay in your home, to stay away from other people? Now, the good news is this is changing pretty dramatically. You'll see towards the bottom of this, the weekly, let me go back, the weekly net scared absolute has increased roughly double digits among all groups in Canada week over week. Okay, so we're seeing that people are actually becoming more concerned for themselves. Females are a little bit more fearful than males on this. And then, you know, it's similar across the age cohorts. And then we looked at a lot of other stuff. So we have a lot of other stuff in our database related to demographics. And I would tell you that we don't see a whole lot of difference between different demographics. People with kids are a little bit more fearful than people without kids, but generally these levels are pretty consistent across all these demographics. So about 40% of people saying not scared, and about 50 to 60% of people saying, yeah, I think I'm somewhat, or I'm pretty fearful. And I would, you know, tell people on the webinar to think, well, where do you fall, you know, on this spectrum, and how does that influence, you know, your behaviors? When we look at the second question, which is, do you feel you have enough information to do something, and you know what to do if you became infected? This number, people have a lot of confidence, and we'll talk about where that confidence might come from. But roughly 80% of people are saying that, yes, I think I know what to do. And then we see this relationship between fear and level of perceived knowledge, where the more fearful you are, the less you think you will know what to do. And so you have a lot of people on the far right of the spectrum who are saying, well, I don't worry, I'm not scared at all, I'm never going to get this is other people. And those are the people that also think they know what to do if they become infected. And I often wonder about this. Is this overconfidence, or is this people that are well informed? It's hard to say. But if it is overconfidence, and these people who say, oh, I'm never going to get it, then they get it and they think they know what to do, but they don't, what's the implication? What will they do in their life? Will they spread it, or will they go directly to healthcare professionals and take care of themselves? I'm going to go through, someone is in here as well asking about the US. I'm going to go into some points on the US. You'll see these coming up here in just a minute. If there's other points you're curious about the US, certainly, you know, we can take that offline as well. But you will get some comparative measures, because when you look at these in an absolute kind of setting, only Canada, sometimes it can be very hard to understand what it looks like in the bigger picture. Now, I'll talk a little bit about this as it relates to the US as well, but let me just go through the data on the page first. On the left-hand side, this is the percent sentiment towards how the government has handled the situation. So about 77% of people, about 3 out of 4, believe that the government in Canada is handling the situation well. And up to 80% are confident in the health authorities, which sometimes can be slightly different than the government in many cases. And high levels of confidence. And so if you have high levels of confidence, it's not surprising that you feel informed. Now, I will tell you, the US numbers are very bad on this. Well, I don't know, maybe I'm a pessimist, glass half empty, maybe not. But, you know, to tell you what the US data would look like, you have just as many people saying very well as very badly, and then it's split on the somewhats. And that's for the government. So just as many people in the US are saying, they're handling it well, as are saying it's handling badly. And well, that sort of depends on what your media outlet is to some extent, right? People are hearing very different messages in the US based on the different media that they consume. And that's pretty concerning, because if they can't agree on whether this is being handled well, if the government actions are good actions or bad actions, what's the likelihood they're actually going to do something about that, right? And the same thing goes with the health authorities in the US. It's not as high as it is in Canada. They're more confident in health authorities than they are in the government. As an American, I probably feel that same way. But they're not as confident in health authorities overall relative to what we see in Canada or even the UK. Okay, moving on from here. This is just a little bit on the sentiment. Then we asked people how they feel about, what actions they think the government should be taking, right? And when we ask people this question, which of the following measures do you think the government should take across the board? We see that, yes, people agree with the actions. That's good. That means that they're probably going to follow sort of instructions and have confidence in what the government is telling them to do. And we see this growing. So canceling large sporting events, supported. Encouraging companies to tell people to work from home, supported. Closing schools, supported, which is scary for some people. If you have kids in school, you probably are struggling with this to some extent right now. I have 2 little kids. It's every day is exciting at home right now. But generally speaking, you see people are agreeing with this stuff, and it's growing. Okay, so what are people doing? This is just a little bit of, we cover a little bit about what people are thinking. What are they claiming they're actually doing? And are they following preventative measures? And we'll get into some of these comparative points with the US now. So the first thing is people are reducing their outside activities across the board, okay? You can see that things like, well, let's call them discretionary social situations, although when I was younger, perhaps going to the gym wasn't discretionary. It was mandatory for me to go to the gym every day. But nonetheless, we're seeing people are curbing their gym and fitness. They're curbing going to zoos and places of worship and all these kinds of things. Malls and shopping centers, obviously, as these things close down, all this stuff is closed. You really don't have an option at some point. But it's good to see that people are complying to that. Now, when you look at other things like public recreation, I live in British Columbia around Vancouver, and we have nice parks, and we have nice forests, and we have nice beaches. If you haven't been here, you should come visit when the time is right, long from now. Nonetheless, we go there and you see people hanging out, you see people congregating in some cases. It's bizarre, but this is not social distancing. So social distancing parties is not social distancing. That's parties. So we have still an issue where you see this on public recreation and workplace and other stuff. Still a third of people are doing that. And so what's the right number here? Well, the right number is 100% not doing this unless you're going to, some sort of a grocery store, or if you work at a grocery store, maybe that's your workplace. But still, we want to see and monitor this and see if we can get these numbers as close to 100% as possible in the coming weeks. Now, when we do look at this, you say, well, those numbers are high. How, is that good? Is that bad? This is relative to the US. And you can see across the board, Canadians are complying to social distancing measures and, doing these things much less than Canadians. So Canadians are complying. And so, when you say, well, what's the outbreak going to look like? Is it going to be as bad in Canada? Will it last as long in Canada as in the US? This is just me speculating a little bit based on the data I look at. I would say it's going to be over faster in Canada than in the US because Canadians are following the rules and following the instruction better than the US. Again, that's just my speculation looking at this data. If you were to look at information on any of the websites in terms of new cases, confirmed cases, it would align with it's going faster in the US than it is in Canada right now. That I looked at last night very closely. So we know that these things are somehow connected. And if you look at these data points next to each other, you'd probably see that there's some sort of an obvious trend. The next thing we asked is, well, what are you doing specifically, not just about leaving your house, what are you doing specifically to social distance yourself or on your hygiene? And then you see here that Canadians are doing a pretty good job. Good job, Canadians. Everybody, or at least 3 out of 4 people, are washing their hands more. The other 1/4 of people, I don't know what they're doing. I don't know why they're not washing their hands more. Maybe old habits, die slowly and they just don't wash their hands. But that's still a kind of a number to look at and say, well, shouldn't everyone be trying to improve their personal hygiene right now, right? Shouldn't everybody be trying to refrain from touching objects in public if they can? Right? I know that's not always easy to do. Not that many people wearing masks right now. Of course, that hasn't been endorsed or recommended by the WHO yet. Probably will happen sooner than later. But we do see on some of these very important measures, people are stopping to do them. So people are avoiding crowded places. And when you look at the delta in the far right column, you see across the board, especially on the social distancing measures, people are doing this stuff. So in order to get these things to move even quicker on personal hygiene, maybe there's some marketing jingles or public service announcements or something that, you know, the government could continue to reinforce to tell people, and that 1 out of 4 people that aren't washing their hands more frequently to wash their hands more frequently. Okay, last couple of slides we'll go through, and I know we're going kind of fast, but we want to make sure we can take questions at the end, and I think the data is pretty straightforward, is behavioral changes related to consumptions of goods and media. Now, these are very high level. Before I get into it, you'll see that right away. They're mega categories and they're mega media channels. We have this at a lot greater granularity, but we're not going to cover all of that today, but we're also working on this as well to try to build things up. Obviously, it's a new issue. And so if you have any suggestions, comments, questions, thoughts, you know, please get in touch with us. Tell us what you're thinking. Tell us how we can help. You know, tell us your ideas. We're a very open company to collecting feedback from people that would care about this. Okay. Let's talk first about stockpiling. Are Canadians stockpiling? It might feel like that. If you go to the supermarket and you try to walk down the paper goods aisle, you certainly think that all Canadians are stockpiling, and you might even go into a slight panic if you see that there's no toilet paper. But if you do need, if you do feel too much fear on this, you can go to, I think it's how much toilet paper counting.com or whatever it is, and you can go on and it'll help you simulate how many rolls of toilet paper you need to get through the pandemic. It's a very useful calculator. Kind of silly that someone made it, but nonetheless, most Canadians are not stockpiling. Okay, just a few people are doing it, and they're ruining it for the rest of us residents. So about 28% of Canadians claim to be stockpiling. And this is very different than what we see in the US, where half of people in the US are stockpiling. Not so good. If you think about the outcome of stockpiling, it does influence, you know, sales and consumption, or at least purchasing consumption and spending. And so we should expect to see that consumption and spending is going up of certain categories. And that's exactly what we see. So not everybody is stockpiling, but when we ask people if they're spending more on these mega categories, groceries, toiletries, entertainment, and clothing, we see that about 1/3 of people, 37%, are saying that they're spending more on groceries, and a little bit, you know, people spending more on toiletries, and then about the same amount on entertainment and clothing. Well, entertainment is a big category, right? Entertainment can include outside activity, it can include Netflix. So we want to break that out a little bit, but nonetheless, we do see that consumption of groceries and toiletries is going up. There's probably some sort of an investment play there long term, but we kind of need to understand beyond just stockpiling why 37% of people are saying that they're increasing their spend at physical stores. So we'll look at that in just a minute. When we look at this relative to the US, well, the US is stockpiling more than Canada, so you're seeing a little bit more grocery. Generally, it's about the same, but generally we don't see that much change in the increase in spend at physical stores across these categories. Obviously, there isn't much increase in physical store shopping for clothing because a lot of these stores are closed, so you know, you don't really have much of an option. We should see that as more of a less spending over time, and as if I go back and look at that, you see that, you know, the big story here is that people are just spending less on entertainment and clothing. Online, it looks a little bit the same trend, although a little bit less change, right? So 27% of people saying that they're spending more on groceries than in the past. You know, it's not as big of a thing in Canada, perhaps, as it is in other markets around the world, where, you know, shopping for your groceries online is a way of life. It certainly was for me when I lived in Singapore for several years, but we do still see that groceries and the change in spend is going up a little bit for groceries and toiletries. And one of the reasons this is happening beyond just stockpiling, and a lot of you I'm sure are experiencing this just like I am right now, is people are making food at home. I don't know how to cook, and I now have to go to the grocery store and buy more food and learn to cook and make my kids terrible meals. But nonetheless, I apologize if this looks a little bit like a discolored checkerboard, but that's kind of the reality that we're seeing right now, is a lot more preparing at home. Dining out is essentially going away, and then ordering food delivery. Interestingly, in this context, people are saying they're ordering less food delivery than more food delivery. Obviously, as dining out occasions die out over the next few weeks. They already have. We should see both of these on the left and on the right going up in terms of the more than. But right now, the story is Canadians are preparing more at home, less so about ordering food delivery. I worked at Uber Eats and spent time in the food delivery sector before joining YouGov a few months ago. And when we think about the online food delivery ordering kind of industry, working that, I remember it was less common to have promotions that were specifically targeted at larger families, people with kids, order for four, all these types of things. There's probably a big opportunity for these companies to rethink their entire promotional structure and what they're offering, and making sure that they provide solutions to more than just single people or a sink and dink kind of households. So preparing at home is the story right now in terms of where the food occasions are going. From a media perspective, Canadians are consuming more media than they did before, and they're doing it on big channels like TV, on-demand entertainment like Netflix, and then browsing social media. To begin with, there are less people on Instagram than Facebook, so less, it's sort of like a moderate change of 38% on a smaller base. TV, most people watch TV, and the expansion on a big channel, it's simple arithmetic that a large number multiplied by a large proportion is a large number. So TV is really where probably the biggest opportunity is to connect and to talk to consumers right now and get messages out to them. And again, this is data that maybe this is important in the business sector, but this is pretty important even for public health organizations and governments to think about. Where do I go to connect with consumers and citizens and residents to tell them the messages that are going to be critical for them to know moving forward? And perhaps in the future we'll see public service announcements on Netflix. I know nobody wants that because people like binging through multiple episodes of a series, but who knows, that could be an outcome at some point. Okay, a little bit deeper on the type of media that people are consuming. Well, TV, and people are consuming the news, general news. So we see that this is a pretty high consumption. 67% of people are consuming more news than ever. I wonder what the mental health outcomes of so much news and so much media is on us. We sit on our phones and read everything about coronavirus, some of which is useful and some of which scares us pretty badly, which might not be all the time very useful. But nonetheless, most people are increasing their consumption of news, some movies, some other entertainment, and obviously sports is something that they've seen a lot of decrease. Obviously, there's no live sports. You can't go to it. You can't watch it on TV. I remember in the early days of coronavirus when it was just starting to spread, but not all the way through Canada, the only thing that I still could rely on was to watch curling. But now curling is gone too. So now there's no more sports. I have heard now that some of the, and I not being the US, but I've heard that some sports organizations are starting to air some of their best hits. So if you're really into the WWE, they're showing the best hits of WrestleMania repeatedly, and that's very exciting for those of you that are into that. But if you're not, I've heard that other leagues are also starting to put kind of their best hits. So we may see some changes in sports consumption. It's not just about live sports. It has historically been, but it'll be interesting to see how that changes over the next several weeks and months. Okay, so I hope that was interesting for you. I hope the sense of humor was not too dry or misplaced. Yes, it's not a time for humor, but it's also a time of high stress, and hopefully all of you are able to sort of like manage and take care of yourselves mentally in a very stressful environment right now. Conclusions, just a couple things that I'll highlight. This gets back to the main point that it's really just a one-point summary on this data, which is compliance is the key. The sense of urgency and subsequent compliance in Canada is better than the US, but it's not near 100%, right? 4 out of 10 still don't express fear towards being infected. If you think fear is a motivator, this would probably concern you. If you don't think it's a motivator, then probably this is not that important. 60 to 70% are reducing outside activities, which is 10 or 15 points higher than the US across situations. But there's still a lot of situations where people are not reducing their outside activities. And this is probably why they'll close down the trails and the beaches and of course the playgrounds are already shut down in British Columbia, but not the beaches, not the forests, not the trails. This could change as well. And 1 out of 4 people cite not increasing personal hygiene measures or avoiding crowded places. Probably will go deeper into what those groups of people might look like and why that might be occurring. Understanding and unlocking the true insight behind that could, save hundreds of thousands of lives. It's important to monitor these statistics. Number one, if we want to control the spread, it requires universal commitment, right? It can't be 2 people like we see in the US disagreeing on whether the government's handling it right or wrong. And some people say, well, they're doing a great job and they don't care. And then the other people say they're doing a great job. This is a problem, because if it's not universal, we all are affected. And we aren't seeing universal agreement across the board, across the world. So this is sort of another data point that people can use, connected to sort of the case data, the new case data that's out there right now, to understand what might be behind the exponential lines or the flattening curves or the not flattening curves across the countries. And that's why we're doing this in so many countries, okay? Behaviors coming from this are going to change. I think people would understand that and would probably agree with that. Some short-term, others forever. And this is where we're getting into more depth for businesses and organizations to help them understand what's going to change and what's going to be forever. For example, cash, when you go to stores now, at least in Vancouver, all of them say no cash, Visa or debit. It's training people towards a behavior that I don't think people will ever go back to cash when this is done. Once they realize how easy it is to just be paying with your phone and clicking your watch and clicking your credit card and not having to worry about this exchange of this messy, dirty, physical thing, it's probably not coming back. And this is something that we want to track. It actually is kind of a very interesting point in time that we live in, because human beings have been passing trinkets of gold and silver and coins back and forth for thousands of years in order to exchange for goods and services. And we are living in the generation, the first generation, where that might completely disappear. And we stop handing things to each other to pay for things like paper, which seems just, if you just think about that abstractly, it seems sort of bizarre. Other things could change forever. You go to a grocery store, and there are lines on the floor that are telling you where to stand, so you social distance yourself every 2 meters. I don't think that's ever going to go away. And if that doesn't go away, what's the implication for a quick service restaurant or a grocery store or any retailer for that matter? What does their store need to look like when they have more than 5 people in line? Are they going to make them stand closer together, or is this 2 meter distancing while you queue going to be here forever? And there's lots and lots of implications to retailers. So we care about these things. We want to look at these things, and we want to track these things and get a better understanding of what's here to stay and what's here just right now. Okay, so in terms of what's next for us as a company and for you, again, the purpose of sharing these webinars, they are for education, they are for information sharing. We don't believe in information hoarding at YouGov. We want people to be informed. We want our clients and our non-clients to be able to leverage our public information. We're expanding what we're doing. The first thing we're expanding is in the area around health compliance. So we showed you a little bit around health compliance, but there's a lot of efforts that we're putting in to go much more in depth. And again, this is to help the Imperial College of London. This is to help government and health organizations. It's free for them, and it's to help them make good decisions in the future. Businesses, organizations are coming to us and they're asking us, what can you do to help me understand my sector? And so the lower part of this slide on the COVID consumer monitor, obviously this is expanded. I've shown you a lot of that today. It's expanded even beyond what I've shown you. And then we're doing other stuff on sectors specifically. We look at everything from apparel and retail to banking and finance and consumer goods and everything else in between. And then trying to understand what's going to happen as the world, well, hopefully recovers economically. I just saw the most astounding chart yesterday on unemployment rates in the US. 3 million people, I believe, lost their jobs. And this has like never been seen since we've been tracking this. So we have a long ways to go in terms of economic recovery, and YouGov will be building tools to understand where people are at mentally and behaviorally and what they're thinking about as the economy sort of comes back from where we've been. Okay, so I hope that was useful. In terms of for you, if you want more information, it's very simple. You can reach out to Rishi or Alex on the call, and they are sort of like looking at Canada and helping us to sort of build in Canada and support people in Canada. You can talk to them directly, so it's good that you have a name to a face today, or you can just, you know, send an email to info@yougov.com, and we can certainly, you know, answer any of those questions we might not get to in the next 18 minutes or until the webinar ends, and we can answer those offline as well. So we're always here to help, to listen. Again, if you have comments or suggestions, please give us your feedback, and we'll use that. And that's very meaningful, and we appreciate that. And with that, why don't we, I'll hand it over to Rishi and Alex for a moment. And it looks like we've had questions coming through in the chat box. So thank you for typing those in, and I'll let them start picking some questions ad hoc to answer, and we'll see how many we can get through and answer. Rishi, over to you.
So Evan, first of all, thank you so much for providing those insights for all of us. Obviously, it's a very serious situation, and we're just looking forward to helping the public good, informing our clients and you know, other people within Canada. We've had a number of questions in the chat. For everyone else that's still on the call, if you have any questions, please put them into the chat here, into the Zoom webinar chat, and we'll get to them in the order they were received. We did receive a question. So it was a question around esports, and Evan, since you've looked at the questionnaires and you have a little bit about the information on what we're asking in regards to sports, the question was, are there any questions about esports following with regards to sports? Since the leagues OWL, CDL, NBA, 2K, etc., can still be played at this time. So do you know, in the monitor that we're sending out on a weekly basis, are we asking questions about esports?
So this is something we have to build up in a custom way. And the reason for that is not everybody plays esports, you know, only a proportion. And so, like I was mentioning at the beginning of the webinar, you know, like this particular questionnaire, we just run to 1,000 people and we get their inputs. And so for these types of industry specific questions, like it probably makes more sense to get an overall sense of, are people starting to adopt esports or not in a greater population, because not everybody's doing it before this, right? And then specifically for people that have been into it, at least sort of like casually or maybe really into esports, then we need to specifically find people in the population that would exhibit that behavior, and then start asking those people questions related to what they're using and not using. So this is something that we are working on right now. It's not been launched yet, but it's sort of, this is one of those ad hoc requests where when we do hear from esports organizations, we'll start building them out.
Great, thanks, Evan. We had another question. It was in regards to media consumption, and what they asked specifically was, do we have data on newspaper, community versus broadsheet and radio? So in regards to what we have within our syndicated services, I know we do track this type of media consumption, but Evan, are we tracking newspaper and broadcast in the COVID monitor currently, and do we have any insights that we can share?
So these data points won't be directly from our monitor, but we do have these data points. Okay, so as I was mentioning at the beginning, we have products like Brand Index and Profiles, which are subscriptions that our company on a regular, normal time period, these are things we sell. Okay, this is like what our business is to some extent, at least a small portion of it. But within some of these tools, we have hundreds of thousands of variables related to categories and related to media channels. And obviously we would have all the media channels, if I'm not mistaken there. I could probably look at this right now. I have the database up. But in this case, we would probably go to that type of a source to try to understand all of these, let's call it non-TV and non-online types of channels. But it wasn't asked specifically in the global tracker. Sometimes I think we actually discount the value of some of these. We get into this mindset where we think everyone in the world is actively consuming only through social media and their phone, but there's still a huge population out there that is not. And without sort of understanding those populations, again, it's universal. If we miss that, you miss the whole thing, right? And so communicating to those people that might be only looking at newspapers or radio, you'd classically imagine that they're a little bit older, but I won't stereotype too much. This is something that we should probably look into, and we have this data, but it's in one of our subscription tools.
Great. Well, thanks for Evan. And for anyone that has any questions in regards to the types of data and data points that we have available, please feel free to shoot us an email at info@yougov.com, reach out to any of us on the call directly. We'd be happy to answer those questions for you. For the next question, and Evan, I just wanted to let you know, someone really liked your commentary. You provide a human touch.
I have a very dry sense of humor. I apologize to anybody who might have been offended by anything I said. I also can be a little bit blunt at times, but I appreciate that. Thank you, Kate, for the nice comment. Just real quick, Ryan Gross, who's also on our team at YouGov, he does a great job of supporting esports. He also commented in there, if you didn't see that question about esports, I think Kristen asked the question about esports, and he said, yes, we do have some of this stuff in I mentioned our profiles database, and there's some stuff in there. And so if you're interested in that, Kristen, we can take that offline and look at that a little bit more in depth, but it's good to see that Ryan is fact checking me. So thank you for that, Ryan.
So we also had another question in regards to the COVID tracker, the international tracker that we have online. They wanted to know when we would be updating it for Canada. So the information that's public is always getting updated online, and it's free. So if you go to yougov.com, you can actually see our international tracker there. In regards to the COVID monitor that we discussed today, that information is being run in 8 different waves. So as Evan mentioned, the 3rd wave just got completed, and that information is going to be available shortly. We do have 5 other waves that we're going to be running over the next 5 weeks. And if you have questions in regards to those waves, we'd be happy to answer that. And for everyone that's still on the call, these waves, although they are rather syndicated with the questions that we're asking, for people that have an interest in, fielding this out to our Canadian panelists, you do have an option of, getting your questions in those waves as well. And if you have questions on that, once again, please feel free to email us or respond in this chat.
Real quick, I'll just jump in, Rishi. Kate Marshall also asked a question here. As you've mentioned, the unemployment and EI sign-up numbers are very high now, unemployment that is, and do you have any plans to check what people are doing when they lose their jobs? Are they looking for new jobs? Are they claiming government funds right away, or not planning to look for a job until COVID is over? This is a fantastic insight, a fantastic question and observation. We have this economic recovery monitor that we're building out, and we're doing this every day right now internally. And I don't think questionnaires and question writing is only as good as the insight of the person writing it. It has nothing sometimes to do with research, but how much insight you have into the world. This is something that I think is very useful to think about. We have similar questions, but I'll look at it again, and maybe we'll try to get this into how we're going to be asking it, because I think this is a very real human thing that people are going through, right? Like, are you going to go out there and look for a job right now? My sister is a physical therapist in the U.S., and she's well, you can't do any physical therapy right now, right? Well, there is no jobs to have right now. So, my family is in the same situation as many people. like that have gone through this. And I would just say, like, yeah, you know, it's interesting to think about when these people might think they're going to go back to work. So we'll take on that feedback and do something with it. Thank you.
Thanks, Evan. So we also had a question in regards to, I guess, our methodology and the sources that we're using. So are we tracking trusted sources? And if so, how do business leaders compare with the government? It's a great question. Evan, what do you think? I know Evan has actively been tracking so many sources across the globe. He's very insightful. So Evan, do you want to talk a little bit about what you've been using and what sources YouGov as a whole is tracking, and maybe talk a little bit about the methodology?
Yeah, I guess. Okay, I mean, like what I've been doing as a sort of a hobby with my at-home time is downloading some of the databases for my own personal use from the WHO and Johns Hopkins, and just spending time just like a propeller head digging through their databases to see where they look different. And, you know, well, the reality is that the numbers on cases are not universal between all these big sources. They're off by, you know, from each other of maybe between 10 to 20%. And I remember when I used to work with Nielsen data a long time ago, if my internal sales data and the Nielsen data were off by 10%, I was probably going to lose my job. So, but nonetheless, I think people are doing their best to try to estimate the right numbers and cases and new cases, and the organizations are just a little bit off. But you can look at that, you can download the databases. There's a lot of information in their databases that can help to inform you if you have that kind of skill and time to look at it. I think it's better than the media itself in many cases. I think this question, though, is about how would we think about government overall versus, let's say, a Donald Trump in the US or something like this. I think that's what Greg might be asking about. And if not, Greg, you can, you know, clarify. But, you know, in Canada, I looked a little bit at the politics and how people are, it's not about a person, but maybe who they voted for or how they affiliate politically. I didn't see as much of a difference as I saw in the US. Now, if I was to highlight a couple points on what we saw in the US, and I put this into the US webinar, when you look at people that voted for Donald Trump versus people that voted for Hillary Clinton, I don't describe them as Republicans and Democrats, because not everybody that is a Republican voted for Donald Trump, and not everybody that's a Democrat voted for Hillary Clinton. In fact, I think that these kind of relationships between your political party and your candidate are breaking down, because we don't like the candidates that are representing our political parties all the time. Nonetheless, when we look at that, who voted for Trump, who voted for Hillary, we see pretty profound differences in their levels of fear. Okay, well, it's as you would imagine, right? People that voted for Donald Trump, fact that we have is they feel less fear, and they feel less worried about contracting the virus than people that voted for Hillary Clinton. And when I looked at that data, and it's very different, and when I looked at that, I don't play politics, I don't care who people voted for, but what I do care about is that if that is going to be a debate, and it comes from, perhaps their media sources are different. Fox News paints a little bit different picture than CNN. Both aren't very good, but they just describe the situation very differently. And I can imagine that's what is informing people to have different views of both the government and their actions and the political leaders. But if we don't all have a consensus on the concern and the fear and the actions, it doesn't matter if we disagree, we all lose at the end. And that's what concerns me about this view of it, is I would say probably there is a difference between business leaders and government overall. We see that in who people voted for in the US, less so in Canada than we see in the US. But again, this divisiveness that's occurring under other circumstances would be fine. Right now, it's probably not fine. You know, this is probably the kind of issue where the media should be reporting the same kind of facts and the same sort of narrative to get people aligned. Anyways, not to rant on media too much, Rishi, but that's sort of my observation in the data and how it's affecting fear and all these other behavioral metrics that we have.
No, I thought that was really good. Thank you very much, Evan. Alex, I'm going to hand it over to you. Evan, thank you so much, and to everyone else on the call. Yep. Alex?
Yeah, for sure. I can kind of quickly close things out. We do have a couple of minutes. If there's any other questions from any of the remaining attendees, feel free to type it in. Maybe I'll just sort of wait in one more minute and see if there's another question or two that trickle in. But otherwise, again, as Rishi said, thank you so much, Evan. That was a fantastic talk, and I hope it was informative to everyone else on the call. And hopefully, we'll be in touch in various ways over the coming weeks, and we'll do what we can to support everyone in our community. As Evan was saying, client or non-client, we're here to help.
Yeah,
And,
just a very quick thing, just so that anybody who's might be confused, like we put some of these together on like a day or two's notice, like we're like rapidly turning things around. Our motto at YouGov is be fast and fearless, not be perfect. And so somebody had asked earlier, just confirming the text at Canada, some of these things say, how does this compare to the US? And some of it is referencing the US. All the data I showed you today is Canada. Some of the little questions on the bottom of the screen that say US were just probably from a cut and paste problem, but all of the data, like I looked at it multiple times, all of the data presented was for Canada, and on the appropriate slides, Canada versus US. So you're not seeing any screwed up data that's US data. It's all Canadian data. Just wanted to clarify that quickly before we close, so that we didn't answer that question.
Fantastic. Okay, I don't see any other, maybe Risha did, yeah. I don't see any other questions trickling in, so maybe we can kind of end it there. And like I said, again, thanks certainly to Evan and also to everyone else for participating.